Okay, good morning, everyone. It sounds like I was on mute there, so apologies. Hope everyone's well. If everyone could remain muted during this meeting will be recorded. So it's Friday the 29th of May, and I hope everyone's well. I just wanted to give you an update on some infection control questions that I've had during the week. So there's been a lot of questions about what are practices doing in terms of PPE when they're seeing patients, and what are they asking patients to do. So I just wanted to break it down into planned and unplanned patients. So if you're having a planned appointment, so somebody's coming in for immunisations, or they're bringing children in, although asking the parent or the patient is not compulsory to wear a face mask, you can discuss this and agree this with patients when they're coming in. It's also really advisable at the moment to screen them on arrival, what we call a hard stop at the entrance, and that is, are you having any COVID symptoms and do you have a temperature? Okay, making sure that the surfaces are cleaned and the equipment is clean between the patients, and also making sure that they've got a specific appointment slot to minimise the time that they're in the practice, and so you've done most of the stuff virtually, and making sure that they're distanced from anyone else in the waiting room. What's really important to consider is reducing waiting time, so making sure they only attend at this specific slot, and make sure the appointment slots are staggered to avoid large groups of people, anyone really, in the waiting room where possible. And reducing early arrivals, for example, telling them to wait in the car and then giving them a call to come in, or waiting outside at a safe distance. And I know some practices it's quite difficult with car park space, waiting room areas, so every practice will have a different sort of area, but sort of maximise physical separation in areas which patients are likely to be kind of possible COVID in those zonings, so we don't necessarily know. And then when you've got sort of unplanned, you've got your urgent patients coming in, again, the same process should follow. You should be sort of do a hard stop at the entrance, again, doing possible temperature checks. So forehead temperature checks is something that we're doing in our practice. So we're asking them, are you well? Is everyone at home well? And then doing a physical temperature check. And there isn't great evidence in that, because if you think someone could have taken paracetamol 2 hours before and actually their temperature could be normal, but these are things that could help you mitigate. So I'm recommending doing a hard stop triage at your front doors. A lot of questions have come about, what do we do with the patients that are shielding? Well, you can provide care at home where possible, virtually or online, or by preference, really, for those patients. But care should be provided in a clinical setting only where it's unsafe to do so from home. So they should really be accessing regular checks and treatment where needed. Particularly, they should be going to outpatient appointments if they've been invited to an outpatient appointment, because actually what the government has said, it is safe for these patients to go to outpatient appointments. So we shouldn't be discouraging shielding patients to attend hospital appointments. And really, we've heard this phrase before, making every contact count. So upskilling staff to deliver more than one check or treatment during someone's visit if they're coming in, or coordinating activities. So for example, in my practice, when children are coming in for their baby IMS, we're also doing the baby checks at the same time, although 70% of the baby check is done online or virtually through a video consultation, and then the sort of the hip, the heart, the eyes, all those bits are done in a face-to-face examination. So that's what we're doing by making every contact count. And these treatments are planned and scheduled, really, and they are really patient-centered. So what we're doing is we're taking account the individual preferences and circumstances of that family, and using sort of the digital tools and technology when balancing well-being and treatment for those patients. So that's really, really important. The next question I wanted to cover today was about what should we be doing with B12. People are asking, oh, I'm overdue my B12, what should I do? So remember, there's two different types of patients. So those that have kind of got B12 deficiency due to diet, for example, or they might have pernicious anemia, or they might have drugs that are causing their B12 to be low, and particularly, for example, metformin in diabetic patients could be one of those. So I think every patient's different, and you should discuss it individually with that patient. But what you can safely do, and we don't normally recommend this, but you can give oral B12 as an alternative to reducing IM injections, and that can be done quite safely. And the British Society of Haematology recommends a dose of 1,000 micrograms per day, although just remembering these 1,000 microgram oral formulations are unlicensed, so it would be a lower dose mix made up to 1,000. And then you should advise them to monitor the symptoms and contact us if they're experiencing things like sort of numbness or fatigue or problems with memory or circulation or irritability. And then there's the patients that have sort of problems with absorption who really don't absorb B12. So you're talking about your short bowel syndrome patients, your patients who've had bariatric surgery or gastrectomies. Those you should absolutely continue B12 because oral supplementation is unlikely to benefit them because they're not absorbing. So definitely continue, because actually then they could be at more harm by not having their B12. But just remember, the need for a B12 versus the risk associated with any face-to-face contact should be discussed individually with those patients. The next thing I'm going to just remind everyone about is the paediatric consultant helpline at Rule Free. And I know a lot of people ask for the number, so I'm just going to give that out again. I'm going to put it in the chat bar as well. So the number for the Rule Free, I'm just going to pop it into the chat bar now, but it's 07893 637 686. So that is the paediatric team on call. I'm just going to put that into the chat bar now, so you've all got that there if you wanted to pop it in your mobile phones and share it. And that line's open Monday to Sunday, including bank holidays, between 8:30 and 5 p.m. And this is really someone you want to get pediatric advice, but it's not an on-call, so you don't think the patient needs to go into A&E or peds on call right at this moment. And they could offer a pediatric hub appointment that you might be able to offer them. There has been a couple of people raised to me that the calls haven't been answered, so if that is still the case, do let me know. The next update before we finish, I've got two more updates for you. The penultimate one is just about the Rule Free lung cancer service. So this continues to operate a straight test model. So the system will automatically book a virtual appointment to ensure that the registration is there on the Rule Free system, which is Cerner, which is the Trust Administrative Program, really. When you book that, or your secretaries book that on ERS, please don't advise patients that that is an actual time. I know that we say to them that, you know, they'll get a call from the Rule Free within a couple of days. And what happens generally is that the service will contact the patient separately, and they're now going to be arranging a straight to test CT scan at the moment. And that is the first thing that's being done for the lung cancer patients. And then once they've had the outpatient CT, a decision will be made as to what care pathway they need to go into. And that's done approximately 3 days after they've had the CT scan. So if a patient said, I had a CT scan on Monday, I'd probably wait till Thursday and say, right, they should hear from the hospital to say, this is the outcome of your CT scan, what are the next steps? Always remember to use the referral form, which is found on Bar Global as well. And there is a telephone number if anyone's got any questions, and I'm going to again put that in the chat bar. So if you do have any questions about sort of lung cancer straight to test, I'm going to put the telephone numbers in, and you can give this to your secretaries, because in case they're chasing up anybody that have got issues about, that's the number that you can give them. The final thing I wanted to just give everyone a quick reminder and update on is about Consultant Connect. So I did a webinar last week, and thank you for 150 GPs that joined us. It was a really well received webinar. And I just want to remind you can access the training online, but I just wanted to give you an update on how it's been in the last few days and what people have been doing and using and what they found helpful. So since that, we've had 214 GPs download the application in Barnet, which I think is fantastic, which is about 59–60% of the GPs in the borough. So do let your registrars and sort of locums know as well. A lot of people are using the dermatology service to send pictures, which is great. Actually, the vast number of these have been dermatology, and with an average response time of 38 minutes. I did one the other day and I got a response in 1 hour and 2 minutes. And just to let you know, if I look at the last 30 odd dermatology referrals that were done this week, 15 of them said they should be a 2-week wait, 15%, sorry. 60 odd percent avoided a referral, 10% of them recommended a routine referral. So they're really good advice with a management plan as well. So I think it was great. And approximately, 95% of people are getting through within about 30 seconds to a minute. And it takes about 5 minutes on the phone to a consultant. If you're using the dermatology one, obviously, you'll get a response, so you won't necessarily be speaking to somebody. And I think, Aj, you said you've used it yesterday and you got an excellent response in 5 minutes, and I think that is amazing. So thank you, and please do let everyone know. Okay, so there's the 10 minutes up. I'm going to stop there. If anyone's got any questions, please use the chat bar, or you can speak freely now and ask me them. If anyone doesn't have any questions, I'll be back on Tuesday. I am considering changing the Tuesday time to a lunchtime to accommodate more people. And again, these webinars are recorded and will be shared in today's bulletin. If there aren't any other questions, have a great weekend, and I hope Friday's not too busy for everyone. And I'll see everyone on Tuesday. Thanks very much, everyone. Have a good day.